What's your thyroid? What does it do? What do you feel like when it's not working well? And what are some tips to talking to your doctor about it? I'm Dr. Penny Wilson, and in this video, we're going to address those four things.
Thyroid Basics, what it does, how to know if it isn't working right, and how to talk with your doctor about it. Your thyroid gland is part of your endocrine system, and your endocrine system is a group of glands that control so many of the functions of your body, and they also talk to each other and control what hormones they produce and in what amount. And a hormone is something that's produced in one part of your body and acts in other places. I have the picture of the butterfly here because the thyroid is a gland in your neck that produces those thyroid hormones, and it actually kind of looks like a butterfly. So if you could see through the skin and the tissue that's on top of the thyroid gland, it would look kind of like a pink butterfly on your neck. What does your thyroid do? Well, it produces a couple of hormones that are responsible for all these things, for weight management, for managing your body temperature, for blood pressure, heart rate, mood, in particular depression, cognitive function. So if you feel like you're just kind of foggy all the time, you can't think clearly, you can't remember things, that's cognitive function issues going on there. They're also involved with growth and reproduction, skin health, muscle strength, cholesterol levels, energy levels, and digestive tract functioning, among other things. Given what your thyroid does, given what those thyroid hormones do, symptoms of low thyroid would be fatigue. You can't get out of bed in the morning. You have to go to bed early at night or maybe take a nap in the middle of the afternoon. Brain fog, cold intolerance. So you feel like you're cold everywhere you go unless it's really, really warm. Carpal tunnel has actually been linked with hypothyroid. Depression, dry skin is another symptom. So is hair loss. So when you wash your hair, do you get clumps of hair out? The other thing you'll notice with hair loss is that your eyebrows thin at the edges. So the inner edges, the outer edges, or both. Those with low thyroid also tend to have high cholesterol, insomnia, so they don't sleep well, low immunity, so they seem to catch every cold that comes through, a slow heart rate, menstrual disturbances, and weight gain, among other things. In my practice, most of the complaints I see from people with low thyroid are weight gain, fatigue, brain fog, cold intolerance, and hair loss. But any of those things could be symptoms of hypothyroid. How to talk to your doctor. Before your appointment, write down your concerns, your symptoms, and your questions. It's good to do this when you have time on your own because then you're not under the pressure in the doctor's office in order to get all your questions out. You can take a few minutes and write down your symptoms, what questions you have, and your concerns. Then during your appointment, take your notes with you. Have a really open and honest discussion with your doctor. Talk through all of those symptoms, questions, and concerns. Finally, ask your doctor to run a full thyroid panel, including tests for antibodies. And if you want more information about that, you can watch the testing video for details on the different tests that they'll run. You really do want to be able to have that open and honest discussion with your doctor about this because they're there to help you feel better. They should be there to help you be healthy. It's important to keep in mind, though, that doctors have really limited time. For most doctors, it's between 6 and 12 minutes per patient. That's another reason why taking your notes in with you helps the process move along and be more efficient. If you feel like you can't really have an open and honest discussion with your doctor, maybe it's time to look for another doctor. If your doctor brushes your concerns off, you might want to go ahead and look for another doctor as well. You want a doctor who can be a partner in helping you stay healthy. So that is information about your Thyroid Basics. If you'd like to talk to me, you can go to my website, drpennywilson.com, and schedule an Ask Penny session, or look at the information about working with me.